Hi everybody, welcome to Healthline. I am Gregory Zarian. It is summer and I'm just going to say this out loud. I've missed you. I hope you're well. I hope you're safe. I hope you are all doing what you need to do to stay well and safe. And with life being a little bit different, that's no excuse to not do any exercises and work out. You can still go for a walk. You can do Zoom classes. I do Zoom classes. You can do everything you did before life shifted a little bit. So if you put on an extra 15, get rid of that now. I didn't, right? Right. I hope you're being safe, and we at Adventist Health wish you all the best and want to make sure that you are doing everything you need to do to be healthy, to stay safe, and take care of yourselves and the ones you love. So the conversation today is all about hernias. Joining us from Adventist Health Glendale is Dr. Nina Behdin, and her specialty is general surgery. How are you, doctor?
I'm doing great. Thanks for having me today.
Thank you for being here.
Yeah,
How are you doing in all the craziness of what's going on?
We are hanging in there, and our hospital is taking all the precautions necessary to make sure that we're able to continue to provide the care that our patients need. I know a lot of our patients are concerned about having surgery. Yes, and I think it's appropriate to take necessary precautions, but we also need to remember we have to take care of ourselves too. And that includes seeing your physician if you have the medical need for.
I love that you said that, and here's what I really like that you said is, you said we, and you're speaking on behalf of the hospital, and you work with one of my favorite people, Dr. Sam Carvajal, who has been on Healthline quite a bit. And I love him. I love you, Dr. Sam. And I'm just going to knock this out really quickly, you said that we are doing all that we need to do. So people can feel safe walking through the doors of Adventist Health and know that everything's being
Yes, so some of the precautions that we're taking include screening all of the healthcare professionals and hospital providers every morning before they come into the hospital. We're also testing all the patients who come through, for example, the emergency department, and isolating any patients who are positive. For patients who are having elective surgery, we're asking them to be tested at least within 5 days prior to surgery and self-isolating until their date of surgery. If they are positive, we do have to reschedule their surgery for the future.
I love that. So bottom line is, as long as I've been part of the Adventist Health Glendale family, whole person care is first and foremost.
We're still continuing that.
Okay, I love that. Okay, when we come back, we're going to find out more about what a hernia actually is. And I have a question. Let me see if you can answer this, and we'll know on the other side who gets hernias more, men or women. Don't go away. Welcome back. I am still Gregory Zarian. The conversation today is all about inguinal hernias. So joining us from Adventist Health Glendale is Dr. Nina Behdin. Doctor, I like having little cliffhangers and little teases. Who gets more hernias, men or women, or does it depend?
It depends on the type of hernia.
Okay.
Today we're talking about inguinal hernias, so it's men.
Oh, okay.
They're
so
actually
yay
eight
guys,
times.
It's about us right now.
That's right.
Share with us your medical history, and then I'm going to dive all into
So I went to medical school at Wayne State in Detroit. I'm originally from California. I did my undergraduate at UCLA, and then went to Wayne State at Detroit for medical school, and then came back to Loma Linda for residency, surgical residency.
So you're a native of California?
I am.
Me too.
Yeah.
Yay, yay Glendale. We're focusing on inguinal hernias, but before we started talking, before we started filming, I threw out all the hernias. There is the inguinal, the femoral, the umbilical, the incisional, the epigastric, and the hiatal hernia. Out of all of them, which is most common?
Ooh, I actually don't know out of all of those.
Okay.
Some of those are in completely separate categories.
Okay.
So
because when people think of a hernia, they most likely think of the hiatal, because we talk about it more. What is a hernia? And
yeah, so you're asking a lot of complex questions, but the basic key is to know what a hernia is and the definition of a hernia. And all that is a defect in any strength layer of your abdomen.
Okay.
Traditionally, the hernias will be located in your torso, and the abdominal wall hernias would include things like inguinal hernias, umbilical hernias, incisional hernias, and epigastric hernias.
Okay.
When we're talking about hiatal hernias, that's actually a hernia that you can't see from the outside. It's on the inside of your body, and it's a defect in the diaphragm muscle, which separates your abdomen from your chest cavity. And that's a completely different category of hernias, so we don't typically
So we'll do it when you
together.
come back.
Sure, that sounds good. So the most common out of the category of abdominal wall hernias is inguinal hernias. Makes up about 3/4 of the hernias that we see.
Because when I was doing my research this morning, I didn't realize there were that many.
Yeah.
And when you think of a hernia, you just think of the one. And you think of the one that is more specifically located near the groin.
And that's because it's the most common one that you've probably heard of, and because you're a male, you probably have heard of it more, maybe from some of your friends or colleagues.
Are they hard to get?
So
Is it, I mean, it seems, I went from complex to simple. Is it a hard?
It's not. It's actually very common. So the lifetime risk for men is about 20 to 30% for developing an inguinal hernia.
Okay.
For women, it's a lot lower. It's less than 5% for women.
So, is somebody born with hernia? With
You
a hernia?
can be. There are some kinds that are more common that we believe you're born with. They're congenital. So there's two types of groin hernias, and I think the two different types is probably more of a curiosity for providers, but for anyone who's interested, there are indirect hernias and there are direct inguinal hernias. They're both located in the groin, and the name just simply means where they're located with reference to the blood vessel that supplies your abdominal wall.
Okay.
So hernias of the groin that are medial to that blood vessel are called direct inguinal hernias. Hernias that are lateral to that blood vessel are called indirect hernias. So what does that mean? Well,
thank you.
What's relevant about the differences in the two for our patients is that the indirect hernias, the ones that are lateral, means that the hernia is occurring in the same canal through which your cord structures, so for the men, the spermatic cord, it occurs in the same canal that the spermatic cord travels.
Got it.
It travels along the side of the spermatic cord and the blood vessels that feed your testicle. And in the woman, those hernias are traveling with the round ligament, which is basically a ligament that anchors your uterus. That's a lot of information.
No. I'm trying to not be in pain in the conversation of it. How does one get a hernia? I mean, because most times when I think of it, I think of when somebody's doing a sport activity, when somebody moves incorrectly. And then I was just talking to a friend of my brother's, and she said she had a hernia and didn't even know it. So how does it happen?
So what I was going to mention about what's interesting about the different types is that we believe that the direct hernias, so the ones medial to the cord, to the blood vessel, that are not involved with the spermatic cord, those are probably hernias that develop through normal wear and tear over the course of one's lifetime.
Okay.
So activities like heavy lifting, weightlifting, people who have chronic coughs, so people who are smokers or have COPD, they are putting constant stress on your abdominal wall muscles and the strength layers there. So they're probably more likely to develop a direct inguinal hernia. The indirect inguinal hernias we think are probably congenital, and then over the course of a lifetime plus the wear and tear, you start to notice it more. You notice a bulge, you have some discomfort, and then usually, by the time you're an adult, you'll be seeing a physician to be evaluated.
And are the symptoms of the bulge per se the same with men and women?
Yes and no. So the great question, because in the man, they can often have the hernia extend into the scrotum.
Okay.
Okay, so they may notice a larger bulge than a woman may.
Okay. And when you say going into the scrotum, does that mean swelling of the scrotum?
It will, yeah, you'll perceive that as a lump or swelling inside of the scrotum.
Okay, and it's time to go to break. And let me just say this real quickly, guys, because then we'll address women. If you see a lump or anything different in regards to your scrotum, don't Google everything and self-diagnose. Call your doctor. More with Dr. Behdin when we come back. Don't go away. Welcome back to Healthline. The conversation is about inguinal hernias. And joining us from Adventist Health Glendale is Dr. Nina Behdin. So, Doctor, I ended it with basically saying, guys, because I sometimes think men do it differently than women, and we all Google things, to not self-diagnose. But if there is a sign or symptom, it's not bad to check it out, but always call your doctor.
Yes, so technology is great, but it cannot do a physical exam. And the key to
diagnosing... Oh, can you say that again?
So unless a computer grows hands, it cannot do a physical exam. And that is the key to diagnosing an inguinal hernia and all types of hernias. You can use imaging as an adjunct, but a physical exam is the key to your diagnosis. And we have a lot of patients who come in who think that they have a hernia and may not. And on the contrary, we have patients who don't think that they have a hernia and they do. So let us help you make that distinction.
Okay, and I love that. So here's the thing: if your computer has hands that come out, and there's like an MD that follows the physical, please let us know how to get one. Doctor, in regards to, you said men that have a hernia will possibly find a lump, or their testicles may be swollen. What could it possibly be if it's not a hernia?
So there are other structures that travel in the same canal, as I mentioned. So you have the blood vessels that enter the testicle, you have the spermatic cord. You can have a variety of conditions which result in swelling of any of those structures, which may not be a general surgery issue. It could very well be a urologic issue, or you may need to see a urologist. But in any case, we can always do a physical exam and, if necessary, order imaging and direct you into the correct specialist if it's not a general surgery issue.
In regards to, just say a man's testicle is swollen and then it goes away. Could it just be that they're swelling and then it goes away and that's fine? Or do you recommend for men to come in and go, hey, can we check this out, especially with, you know, prostate cancer and all these other things that can happen?
Yes, so definitely have that checked out.
Got it.
And one of the reasons is when you have a small inguinal hernia, it's very common for the hernia to protrude if you're doing activities that require straining. So if you're having, you know, difficult bowel movement, or you're doing weightlifting or helping a friend move, you may notice the hernia come out, and then later during the day when your body is relaxed or you're lying down, it may go back in and disappear. So that's something we can also test for on an exam.
Is there any difficulty urinating or no?
Not typically.
Okay. And with the protrusion, is it the same with the female as well? So,
yes.
So, and the location would be around the same area?
In the groin.
In the groin area.
Yes.
What are signs and symptoms?
So the most common sign is a small bulge. It'll start as a bulge. You may have some discomfort that's associated with it, especially if the bulge comes out and you cannot push it back in.
Should you try to push it in?
You should absolutely lay down, relax your abdominal wall muscles. It helps if you bend your knees. Okay. And put slow pressure on that and see if it can go back inside. Now, if you're not able to... But if it goes
back inside, do you think, okay, it went back inside, I'm good to go?
You still need to see a surgeon.
Okay.
You still need to see a surgeon. Yeah, it just means that you caught it early.
Okay.
And that hopefully when you get to surgery, it's a much easier surgery for you and can be done minimally invasive.
Okay. And if you can't push it back, then you, of course, call your doctor.
You need to call your doctor at that point.
Are hernias deadly?
They can be. So if you are at the point where you have a hernia that cannot be reduced, meaning pushed back in, there's always a risk that your contents from your abdomen are being pushed out. And some of those contents include your bowel, your small intestine, your large intestine. And if those are stuck, it can compromise the blood supply to those organs, which leads to ischemia and perforation, which are problems that, you know, can be deadly if they're not treated very quickly. In regard,
you know, when we talk of cancer, it's stage 1, 2, 3, 4. Are there stages of a hernia, or is it just mild, bad?
Either you have one or you don't.
Okay. Okay. And does a hernia ever go away on its own?
No. No.
Okay. I come in and I see you and Dr. Sam, and I'm not going to say me because I don't like to. Somebody comes in and sees you and Dr. Sam Carvajal, and they have a hernia. What is the protocol? What is the procedure?
So we start with a history and physical exam, of course, and then decide if we need any additional tests or imaging. Typically we don't. And if you do have a hernia, we'll talk to you about your options for surgery and find a time that works for your schedule to get that done.
When you say history, you're talking, but you also mean, and I say this a lot on the show as well, to share with the doctors and the surgeons family history.
That's part of it,
okay.
Yes. So we ask about any other medical problems you may have, surgeries you've had previously. It's important for us to know if you've had a hernia repaired before and in what fashion they had fixed it surgically for you, whether it was done with an open surgery or done laparoscopically. And that all of that helps us decide what kind of surgery is the best for you.
And when you say laparoscopic, that's the Sills method?
Minimally invasive.
Minimally invasive. Do they come back in the same place? Can they?
So if the recurrence rate is very low for surgery, and we've gotten that recurrence rate even lower with the use of mesh. So that's now the standard of care. I know there's a lot of patients who have concerns about mesh, and we'll talk a little bit more about that when we talk about the surgery itself. But these are polypropylene mesh. They've been in use for many, many years, and we haven't had any major issues with them. And I always tell my patients, if you want to have a hernia repaired without mesh, you almost may as well not have the surgery.
Sure.
Your recurrence rate is a lot higher.
Real quickly before we go to our final break, can you tell everyone how safe it is to finally go back into the hospital?
Please, please, please come and get your medical problems taken care of. We have all the PPE that we need to see you safely. We are doing health screenings every day for our healthcare providers. And if you do need a procedure, we'll make sure we get that done for you in a safe environment as well. And you, along with everybody else who's having elective surgery, will be tested for COVID.
Thank you. When we come back, more Dr. Behdin. Don't go away. Welcome back to Healthline. Adventist Health Glendale recently received its 11th A grade in a row for patient safety from the Leapfrog Group. Rated 5 stars, the highest possible rating by the Centers for Medicare and Medicaid Services. The conversation today is all about inguinal hernias. Joining us from Adventist Health is Dr. Nina Behdin. Congratulations to Adventist Health and
that's amazing.
Getting its 11th A grade. People are so afraid to come back to the hospital and get a procedure, and even with the emergency room at Adventist Health, who I've gone to and have been treated so kindly and efficiently and effortlessly. What can you say to everyone, Doc, so they can come back?
Well, I just want to actually thank Adventist Health for not only keeping our patients safe, but also the providers. I feel very fortunate that I've been able to continue going to my office and seeing patients in a very safe environment. We're taking all the precautions necessary to make sure that we keep our patients healthy through this pandemic so that they can have a normal life once this is over. And it's so important for our patients to know they can continue to come and see us, whatever medical needs they have, whether it's through the emergency department or seeing us in clinic. You're surrounded by healthcare professionals that have been tested, that have been screened every day. And if you do need a surgery, we're of course making sure that all our elective surgeries, patients who are having elective surgery are tested as well. So it's safe. Please come and see us. We want to take care of you, and I hope that you don't let this pandemic take a hold of your health care. You still need to be the one in charge.
And it also speaks for itself, the 11th A award by the Leapfrog Group. And it also just means one thing that I have enjoyed in regards to people on a whole is we are being more mindful. We are washing our hands more. We are being more courteous. We are paying more attention. We are wearing our masks when asked of. So it just makes us more aware of everybody else.
That's correct. And these are all the things that we're doing on a daily basis, and after doing that it starts to become second nature. So hopefully, we're taking all the precautions in our office, sanitizing all the rooms before and after all the patients enter, washing our hands, hand sanitizer is available, we have all the gloves and masks necessary. So we're well equipped to take care of patients.
Love that, thank you. Before we got involved in washing our hands and masks and how great your care is, and for you and everybody on staff that really puts yourself out there for us to make us healthy, on behalf of everyone at Healthline, thank you. So John Smith has to come in and have surgery. You were speaking of the mesh procedure. Is that standard?
Yes, so there are broadly two categories, two ways to repair hernias. One is with open surgery and one is laparoscopic, which is minimally invasive. And within that category of laparoscopic surgery is a surgery called single incision laparoscopic surgery. SILS, which you're very familiar with. But that's how I prefer to repair hernias, assuming that the patient is a good candidate for that procedure.
And is that when you go through the belly button?
Yeah, so we make one small incision at the lower aspect of the belly button, and I'm able to go in with a camera and 2 instruments. Okay. And the wonderful part of this procedure is that I'm in an area where I'm able to look at both sides of the groin. So if you have a hernia on the other side, we're able to see that at the same time of surgery.
Would you take care of it at the same time?
We would, if we see that. If the patient agrees that if we see a hernia, we will fix it on the other side at the time of surgery, then we will.
Listen, if I ever have a hernia, do that. Do whatever you need.
That's what most of our patients say, but it's always an informed discussion that we have before surgery.
And I love that because most people think, well, if I'm out, I don't know. So that's a conversation that you and Dr. Sam have with patients and all the doctors at Adventist Health, because having a procedure, no matter what it is a conversation.
That's right. It's a joint decision.
When you say, doctor, you said the SILS procedure, the other procedure is?
Open surgery.
Open surgery, and what is that?
So that's a very traditional way of repairing a hernia. So we preserve this for hernias that are larger, oftentimes hernias that are recurrent. If they've been fixed laparoscopically before and they recur, we'll fix it open. And in some patients who are not good candidates for general anesthesia, we're able to do the repair open with just local anesthetic and some sedation. So it's a good option for the right patient, but if you're the perfect operative candidate, I would still prefer to do the surgery SILS. I think it has the best outcome for the patient.
What are we looking at recovery-wise?
So if you have the SILS surgery, about a week recovery. Usually patients take a couple days to relax at home. They're up and walking the same day as surgery. You're eating a regular diet, doing light activities, and by a week
you're ready. And when you say light activities, that means just walking?
Walking, you can do light jogging. We encourage patients to restrict how much they're lifting for about 6 weeks after surgery. And that's just to allow the mesh time to incorporate into your body walls, allow your tissues to reach their maximum healing capacity before you exert pressure on them again.
And is there physical therapy involved?
No, not traditionally, just go about your normal activities.
And is the same recovery the same thing with the open surgery?
A little bit longer for that, probably closer to 2 weeks.
Laser questions. What's the youngest somebody can have a hernia, inguinal hernia?
We have babies, newborns that can be born with them.
Okay, to
90s, end of life, yeah.
How can somebody prevent a hernia, or they can't?
So there are probably some things you can do to minimize your risk, but I will just say it's more important to have a normal life and do all the activities you need to do. If you can avoid lifting very heavy items, smoking gives you a chronic cough. It's always better not to smoke. But again, you just have to live your normal life. If you think you're developing a hernia, see a physician for evaluation.
Final thoughts in regards to health and safety and coming back to see you guys. What are your final thoughts?
I mean, the way I tell my family and friends is if you're going to the grocery store to buy your groceries, coming to our office is safer than that.
Oh.
Okay.
Okay, so if I come to the office, can I just get a chicken sandwich and fries too on the side?
Sure. For you, yes.
Yay, me. Once again, on behalf of all of us and personally from me, thank you for doing all that you do and being on that front line to make sure that I and everybody else are safe.
Of course.
Will you come back?
Yes.
Because you said in the beginning we were complex, and I love to just attack part 2. Will you come back for part 2?
Yeah, absolutely.
Great. Thank you. And thank you. So you heard it from Dr. Behdin. Going back into the hospital, Adventist Health, it's safe. You also have your part. Wear your mask, wash your hands, be mindful of other people. If you are not feeling well, stay home. Take care of your loved ones. Do the social distance thing. Do everything you want done to you. Do it back to everybody else. And in regards to hernias, don't overlift, don't overdo anything, and don't self-diagnose. Our mission here at Healthline is to bring you all you need to know to keep you as healthy as you can possibly be. Drink lots of water, get some exercise. Even though we are in this awkward time in our lives, it does not mean you have to stay on your computer and stay on your phone. Go out, get some air, take care of yourself, be mindful of others. Please find us on social media. You can always find us on Facebook at Glendale, LinkedIn Adventist Health, and you can always find me at Gregory Zarian. Remember, the most important conversation you're going to have is about you and your health, so why not start talking about it now? We'll see you next time. Thanks.